Partha, thank you so much for talking to us about ROCkeTS' recruitment at Durham and Darlington. Could you tell us, please, how you managed to recruit for ROCkeTS at your site?
First of all, Sudha, thank you very much for giving me this opportunity to discuss the trial. I first noticed ROCkeTS because our research nurses go through all the database of gynecology trials, and they noticed and flagged this up as a trial we may be able to recruit through too. And the reason I got interested was I noticed the IOTA rule guidance on scanning, and I thought this is a way we could get consistent scan reports in our department. So I spoke to the scan department, and they're very keen to get involved in the training, and they saw it as a way to standardize reports. So from the start, we were getting everyone on board. So most of the patients we recruit come through the Gynecology Rapid Access Clinic, which is an all-day clinic on a Thursday in the Durham area, and is an equivalent clinic for Darlington, based in Bishop Auckland Hospital. And in that clinic, we have a consultant, a couple of trainees, nursing staff who are regular nursing staff who are used to coming to that clinic, and research nurses who are usually there. And all patients who are coming for abnormal symptoms usually get a scan. And when you come into the hospital, the first thing is we have lots of boards up, which the research teams have put up saying Durham is involved in research, as is Darlington. And then when they go for their scan, they're handed leaflets and told this may be a study which you may be interested in, and the sonographers tell the patients that doctors may talk to you about this study. And at the start of the day, the whole team, we have a briefing so that we speak to the registrar, SHO nurses, and say, these are the trials we're recruiting to. Look out for patients to see if you can recruit to them. So all our trainees have GCP. They come in as, when they first get their induction, they get GCP, a mini course, so they're able to talk to patients. And then they will see the patient and flag up, and then our research nurse will discuss. It's important to say not everyone agrees to enter the study, and we don't get patients from clinics such as fertility clinics or mental disorders clinics necessarily. But I do get a lot of patients flagged up from the other specialties referred to the rapid access clinic, such as gastro and colorectal, who refer cysts which are detected on CT, and we scan them all according to the IOTA guidance, and quite a few of them will go in the trial. The main thing we have the problem is the time. So if we don't get them at the first visit, usually they're not particularly interested. And occasionally I'll write to patients who have noticed where somebody has been missed and said, are you interested in the study? And if they are coming back for any reason for it, such as markers to be done or something, then they will often go into a trial. But it's important to say not everyone is keen on the study. But we do our best to get them on. But the main thing is everyone is motivated, everyone knows their role, and everyone is keen to recruit to a trial. And interestingly now, they know that Durham is currently recruiting. It has become a bit of a competition to see how many we can get into a study as well.
That's lovely. That's really lovely. So in terms of tips, did you have any tips for other people who are taking ROCkeTS on at their sites?
I think the main thing is we've got a dedicated rapid access clinic, so we have up to 25 new patients on the day there, and the majority of those will be scanned for either bleeding problems or symptoms suspicious of ovarian cancer, or patients have been referred from other specialties. So we're able to gather all the patients into one site on a day, if you like, and the whole team is there. But as I said, the easiest time to encourage your patients to enter a trial is on that day they're first seen. Later on, we're less successful in persuading people because, we're having a bit of a debate in our trust about the value of research clinics, and I'm of opinion that it's not really helpful because you have to screen a lot of patients before you get a patient. And a research clinic in a district general hospital such as ours is probably a waste of time and effort. So it's a motivation of a team. The trainees are really keen to be involved. And there are lots of boards about research, lots of leaflets about research, and the ROCkeTS. Every trial that we're doing, there's a poster in every single room so that the patients will be aware of it.
That's wonderful. I think it's quite clear that you've got your team motivated, including your trainees, and that's really paying off for you in terms of not just recruitment to ROCkeTS, but recruitment to other trials. So well done, and thank you so much for participating.
You're welcome.